This is Sleep Better TV. I'm Scott Drake as we continue our discussion with Dr. Blake Perkins from his offices in Vancouver, Washington at Dental Sleep Medicine of Vancouver. And we continue our discussion on sleep apnea. So I guess we should begin by defining it. What exactly is sleep apnea?
Well, sleep apnea in the most basic terms is a cessation or a stopping of breathing while you're asleep.
Now, could a child have sleep apnea?
Absolutely. In fact, about 10% of children snore while they sleep, and of those, about 4 to 6% of children actually have obstructive sleep apnea, which is a blockage of their breathing while they're asleep.
So with children in mind, how is it diagnosed and treated?
Most of the time, it's diagnosed through the symptoms that they exhibit in their waking hours. A lot of times a child who has obstructive sleep apnea is either irritable or cranky when they get up in the morning. They can have morning headaches. They can be inattentive at school. And as we all know with children, some children who are overtired rather than look or act sleepy tend to act more hyperactive and are difficult to converse with or difficult to manage, and they seem to be trying to go everywhere all at once. Unfortunately, some of these children are actually diagnosed with ADD or attention deficit disorder or attention deficit hyperactivity disorder, when in all reality, the underlying cause is obstructive sleep apnea and not a neurological problem.
So Dr. Perkins, finally, the treatment options for children may be different than adults. What can be done typically for children?
Usually the main cause of childhood obstructive sleep apnea is enlarged tonsils and adenoids, and potentially also an enlarged palate or some dental deformities of the palate itself. And so the first step or line of treatment for a child with obstructive sleep apnea is a referral to an ear, nose, and throat physician who will examine their tonsils and their adenoids and most commonly have those removed. After the breathing problem is treated, most of the time the irritability and the headaches and the behavior problems subside because they're able to get a quality night's sleep.
All right, Dr. Perkins, thanks again.
You're very welcome.
My guest, Dr. Blake Perkins from Dental Sleep Medicine of Vancouver, Washington. This is Sleep Better TV.